On operation day, patients typically arrive 2 hours before their scheduled procedure. This allows enough time for preoperative nursing assessment, starting IVs, and receiving pre-op medications with the anesthesiologist. On operation day, you will need a driver to take you to the hospital who knows the way. The clothing to wear to the hospital should include your usual underwear, elastic band pants, extra large sweatshirt, loose socks, slip-on shoes. Also bring a blanket or an extra large jacket for discharge appropriate for the predicted weather. Bring a telephone number of where your driver can be reached. Cell phone and other valuables should be left at home. In most situations, patients will be given a light general anesthetic in combination with a block of shoulder and arm. A block is usually done by a painless injection of local anesthetic into the neck. The block anesthetizes the nerves to the upper extremity. This allows the patient to undergo the procedure with much less anesthetic agent, and the patient has minimal, if any, pain for the duration of 12 to 24 hours and has a quicker recovery. Once these anesthetic agents have been administered, you will be out. You will be moved to the surgical theater where your shoulder is sterilely prepped and draped. At this point, your surgery will begin with the insertion of a fiber optic orthoscope into the shoulder joint, allowing your surgeon to see detailed condition of the shoulder and proceed to make necessary repairs. When the surgery is completed, the endoscopic equipment is removed. The wounds are typically sutured closed and reinforced with steri strips. Following the surgery, you will be brought to the recovery area where there will be nurses and doctors, all of whom will assure your early recovery goes smoothly. Once you have recovered enough to meet certain criteria, you will be moved to the final recovery for another 60 to 90 minutes with careful monitoring by the hospital staff. During final recovery, you will be getting dressed. Oversized clothing eases putting on your t-shirt, your elastic band pants. Nursing will help you put on an oversized turtleneck shirt, and an ice pack goes on over this shirt. The nurses will put on your ice system for you to help control systems such as pain, inflammation, swelling, and buildup of fluid in the shoulder. Your shoulder also needs to be protected from deleterious motion even while icing. Reaching or lifting during the first 4 to 6 weeks can cause the repaired tendon to pull away from the bone, preventing the repair from healing, even if it fails pain-free. When your shoulder immobilization device, be sure that the proper position and placement are always achieved. This shoulder immobilization device, it should be worn 24/7, except when dressing or bathing or performing passive range of motion exercises. Once discharge criteria are met, all of the discharge instructions will be gone over in detail. Listen carefully and ask your caregiver to write them down. You can nod your head now, but will you remember what they said in 24 hours? You'll be given instructions on how and when to use drugs to control the pain and the risk of infection. The list of prescriptions that will be needed to be filled that day. They will tell you how to care for the incisions and puncture wounds. They'll tell you about sleeping with your involved arm elevated in a sling.